COVID-19 vaccine. Should governments force vaccination? To beat the pandemic, we need dozens to hundreds of safe and effective COVID-19 vaccines. Only through widespread vaccination, the world can achieve herd immunity. So, should the vaccination be mandatory? Alberto Cubilini at the University of Oxford and Vagish Jain at the University College London shared their expert opinion. On one side, COVID-19 vaccination is mandatory for select groups. There is an ethical reason for it. If there is a way to prevent harm to others, it demands consideration. If it highly prevents harm, it demands urgency. In infectious diseases, vaccines can do more than just protect recipients. It may eliminate or greatly reduce the risk of spreading infections to others. When more people are vaccinated, the faster it is to reach a state wherein nearly everyone is immune to a disease. To achieve herd immunity, people in communities should play a part. Their main job is to protect those unable to get a vaccine due to chronic illnesses. Immunocompromised, allergic reactions, and pregnancy are red flags in many vaccines. Sadly, mandatory vaccination may not help with public trust. Transparency is key to building trust, but it can either increase or decrease confidence in vaccines. Thus, forced vaccinations require careful weighing between vaccine uptake and public trust. For public trust, regulatory bodies have to step in the decision-making of mandatory vaccination. For example, Public Health England does not classify COVID-19 as a high-consequence infectious disease in the UK. This is because of the low case fatality rate. Among people aged 80 years and older, the fatality rate is 7.8%, while in children aged 9 and younger, the rate is 0.0016%. So, vaccination is likely optional in many scenarios. If the fatality rate is 50%, like in Ebola, vaccination will become compulsory. Compulsory supports increased vaccine uptake to lower infection and death cases. Though, forcing people to get vaccinated does not always result in impressive uptakes. When done inappropriately, the compulsion may lead to social defiance. But here's one logic. When a deadly virus strikes both public health and the economy, something needs to be done or society will collapse. Rather than shoving vaccines forcibly, why not go to the local level and work with people in communities? This way, the healthcare sector can find those who are prone, those who have doubts, and those who are unaware of the dangers. These simple barriers can make or break new outbreaks. Experts wrote in the conversation, mandatory vaccination is rarely justified.